There's a quiet moment that many people over 60 remember. The first time their knee didn't feel like their own. It might have happened when you stood up from a chair and felt a sudden stiffness, or when you tried to go down the stairs and hesitated, holding onto the railing just a little tighter than before. Maybe you told yourself, it's just age. It's normal, but deep down, something didn't feel right. And here's what most people don't realize. Your knees are often the first part of your body to quietly weaken, long before you notice serious problems anywhere else. Not your heart, not your lungs, not even your back, your knees. Because they carry you every single day. Every step, every turn, every moment you stand, sit, or walk. Your knees are doing the hard work silently, without asking for attention. Until one day they do. And when they begin to weaken, it doesn't just affect your movement, it slowly begins to affect your confidence. You walk a little slower, you avoid stairs, you think twice before going outside. And over time, something even more dangerous begins to happen. You start to lose trust in your own body. But here's the part that might surprise you. In most cases, knee weakness is not simply wear and tear. It's not just because you're getting older. And it's not something you have to accept. In fact, there is one simple, powerful movement. A safe, doctor-recommended exercise that can begin strengthening your knees almost immediately when done correctly. Not complicated, not painful, and you can even do it at home. But before I show you that, you need to understand something very important. Because many seniors are unknowingly making one critical mistake every day. A mistake that is actually accelerating knee weakness instead of preventing it. And if you don't catch this early, it can lead to chronic pain, loss of balance, and even serious falls. So in this video, I'm going to gently walk you through everything you need to know. You'll discover why your knees weaken faster than other parts of your body, the hidden habits that are silently damaging them, and most importantly, the one simple exercise that can help restore strength, stability, and confidence in your daily life. And please stay with me until the end, because I'll also share a small daily routine that many of my patients use to protect their knees for years to come, without needing expensive treatments or medications. This isn't about pushing your body, it's about understanding it and supporting it the right way. So take a deep breath, relax your shoulders, and let's begin this journey together. Because your knees are still capable of strength. More than you think. Now let me explain something in a very simple way. Because once you understand this, everything about knee weakness will start to make sense. Your knee is not just a joint, it's a meeting point. A place where your thigh muscles, your lower leg muscles, your ligaments, and your cartilage all work together like a team. And just like any team, if one member becomes weak or stops doing its job, the entire system begins to suffer. Here's what quietly happens with age. The muscles around your knee, especially the quadriceps in the front of your thigh and the small stabilizing muscles around the joint, begin to lose strength. Not suddenly, but slowly, almost invisibly. This is something we call muscle atrophy, and it can begin earlier than most people expect. And when these muscles weaken, your knee doesn't get the support it needs. So instead of the muscles absorbing the pressure when you walk or stand, that pressure starts going directly into the joint itself. Over time, this leads to stiffness, discomfort, and that heavy, unstable feeling many seniors describe. But here's the important part. This is where many people get it wrong. They think the solution is to rest more. They avoid movement, they sit longer, they reduce activity because they're afraid of pain, and while that might feel helpful in the short term, it actually makes the problem worse. Because when you stop using those muscles, they weaken even faster. It becomes a cycle. Weak muscles lead to knee discomfort. Discomfort leads to less movement. Less movement leads to even weaker muscles. And suddenly, simple things like standing up or walking across the room feel harder than they should. I've seen this happen with so many patients. One gentleman, in his early 70s, told me he stopped taking his daily walks because his knees felt too fragile. Within a few months, not only did his knee strength decline, but his balance, confidence, and overall energy dropped as well. It wasn't his age causing the problem. It was the lack of the right kind of movement. Now let's gently clear up another common myth. Many people believe that walking alone is enough to keep their knees strong. And while walking is good for your overall health, it's not always enough to rebuild strength in the specific muscles that support your knees. What your knees truly need is targeted support. Controlled movement that activates and strengthens the muscles around the joint without putting unnecessary strain on it. And this brings us to something very important. Not all exercises are good for aging knees. In fact, Some common exercises, especially high-impact movements or deep, uncontrolled squats, can actually put more stress on already weakened joints if done incorrectly. This is why many seniors feel worse after trying random exercises they see online. So the goal is not to do more. The goal is to do the right movement. A movement that gently wakes up those sleeping muscles, improves circulation, supports the joint, and rebuilds stability step by step. And the good news is, your body is still capable of responding, even in your 60s, 70s, and beyond. Your muscles can regain strength, your joints can feel more stable, and your confidence can come back. You just need to give your body the right signal, consistently and safely. And in the next part, I'm going to show you exactly how to do that. A simple, safe exercise you can start at home, along with daily habits that can quietly protect your knees and make walking feel easier again. Now let's move into what truly matters. What you can actually do starting today to support your knees in a safe and effective way. I want you to remember this. Your knees don't need force, they need support. And one of the most powerful ways to give them that support is by strengthening the muscles that protect them, especially the front of your thighs. So let me guide you through a simple movement that many doctors and physical therapists quietly recommend for seniors. The seated leg raise. Sit comfortably on a chair with your back straight and both feet flat on the floor. Now slowly lift one leg until it is straight in front of you. Not too high, just enough to feel your thigh muscles engage. Hold that position gently for about 3 to 5 seconds, and then slowly lower it back down. No jerking, no rushing, just smooth, controlled movement. Then repeat with the other leg. At first, it may feel very simple, even too easy. But don't underestimate it. This small movement directly activates the quadriceps, the very muscles that stabilize your knee joint. When done consistently, it begins to rebuild strength where your body needs it the most. Start with 8 to 10 repetitions on each leg once or twice a day. And if that feels comfortable after a few days, you can slowly increase the hold time or repetitions. The key here is not intensity, it's consistency. Your body responds to gentle, repeated signals much better than sudden effort. Now here's something very important. While doing this exercise, pay attention to how your knee feels. You should feel the muscles working but not sharp pain inside the joint. If you do feel pain, reduce the height or duration. Always respect your body's limits. Along with this exercise, there are small daily habits that can make a big difference. For example, avoid sitting for long periods without movement. Even standing up and walking around your room every 30 to 40 minutes can help keep your knee joint active and lubricated. Your joints are designed to move, and movement is what keeps them healthy. Another gentle habit is to support your knees during transitions. When standing up from a chair, use your hands on the armrest or your thighs to reduce pressure on your knees. It may seem like a small thing, but over time it protects your joints from unnecessary strain. Your diet also quietly plays a role. Foods rich in protein help maintain muscle strength, while nutrients like vitamin D and calcium support bone health. Even staying properly hydrated helps keep your joint tissues functioning smoothly. These are small, simple choices, but they add up. Now let me gently warn you about a few common mistakes I see again and again. The first is doing too much too soon. Many people feel motivated and try to push themselves, but this often leads to discomfort and discouragement. Slow progress is still progress, and it's the safest kind. The second mistake is inconsistency. Doing an exercise once in a while will not create lasting change. Your body needs regular signals to rebuild strength. Even a few minutes every day is far more powerful than a long session once a week. And the third mistake, ignoring early signs. If your knee feels stiff or weak, don't wait for it to become painful. That early feeling is your body asking for support. And when you respond early, the results are often much better. So take this as a gentle beginning. Not a burden, but a simple routine you can quietly add to your day. No pressure, no rush. Just steady, mindful care for your body. And in the final part, I want to speak to you from the heart. Because this journey is not just about your knees, it's about your independence, your confidence, and the life you want to continue living. Take a moment and think about what your knees truly represent in your life. Not just movement, but freedom. The freedom to walk into another room without hesitation. To step outside and feel the air on your face. To visit loved ones, to stand in the kitchen, to live your daily life without constantly thinking about every step. For many people, knee weakness doesn't just take away comfort. It slowly takes away independence. And that loss doesn't happen all at once. It happens quietly, in small moments. Choosing the elevator instead of the stairs, sitting down more often than you used to, avoiding places you once enjoyed. Until one day, your world feels just a little smaller than before. But here's what I want you to understand, very clearly. This story does not have to continue in that direction. Your body is not finished. Your muscles are not done responding. Your knees are not beyond help. Even now, your body is listening to you. Every small movement you make, every gentle exercise you repeat, every time you choose to stand, to walk, to care, you are sending a message to your body. Stay strong, stay active, stay capable, and your body responds. It may not happen overnight. You may not feel dramatic change in a single day. But something very powerful begins to happen beneath the surface. Your muscles start waking up, your joints begin to feel supported, and slowly, that sense of confidence starts returning. You begin to trust your steps again. You begin to move without overthinking. And most importantly, you begin to feel like yourself again. So don't think of this as just an exercise for your knees. Think of it as a quiet daily promise to yourself. A promise that you will not give up on your strength. That you will not accept unnecessary limitations. That you will continue to show up for your body, one small step at a time. Because the truth is, it's not about doing something perfect. It's about doing something consistent, a few minutes a day. A simple movement, a little awareness. These are the things that rebuild not just your knees, but your confidence, your independence, and your quality of life. So start today. Start gently. Start where you are. And if this message spoke to you, if it helped you see your body in a new way, then take a moment to support this channel. Like this video, share it with someone who might need it, and subscribe for more simple, trusted guidance to help you stay strong and independent as the years go by. And I'd truly love to hear from you. Tell me in the comments, what is one small step you're ready to take today for your knees? Because your journey doesn't end here. In many ways, it's just beginning.